at what point does behavior intervention become coercion?
Ooh.
I think, you know, it should never have coercive contingencies in play. You should
Yeah.
never be using an individual's personal items, objects. You should be supplying the reinforcement. Um,
There
you
shouldn't
know,
be a fear or a, negative experience that's happening beyond replacing a behavior with something that's safe or something that's healthy for that person. Um,
and I always say that safety trumps all treatment plans.
Absolutely.
At the end
Yeah.
of the day, you know, safety comes first. Don't follow the behavior plan if someone's safety is in jeopardy. And that's really what we
Yeah.
train is that safety trumps any treatment plan. Um, so, there is a coercive cycle in ABA. Gerald Patterson, I think it's 1969. And this really describes a contingency between a parent and a child. And this is a really actually common contingency in which the parent gives a demand.
Mm-hmm.
The child puts up a protest. The parent then walks away and says, you better clean your room. If you don't clean your room this Saturday, there's going to be no football on Sunday, right? And then the parent walks away and the child avoids the task. And when I say the child, it could be a husband. I'm just saying. It could be a husband as well. The person that avoids the task, then the parent comes back and uses more threatening prompts.
Mm-hmm.
Clean your room, then walks away, and then the child or husband doesn't do it. And then it keeps just escalating up. And we do call that a coercive cycle.
Yeah.
And you really change that and treat that with a high rate DRI, differentially reinforcing, which is crucial in our field.
Absolutely.
I mean,
Yeah.
that's really at the simplicity level.
Mhm.
We are differentially reinforcing behaviors. Well, what does that mean?
Well, so we are giving more emphasis, more reinforcement, more positive interaction for the behaviors that we're looking for, and we're not necessarily providing that stimulus if we are seeing another behavior. So what we're trying to do is enrich that person's life as easily as possible to shape that behavior to something that's healthier or safer or better for them in the long term.
Yeah. So is ABA coercive? I would say no. I would say we're really looking to motivate and reward behaviors that are good for the person, that
Yeah.
are going to produce more natural, like language, right? That's such an important, pivotal behavior. So for me, it's a no. Is it for you a no?
I think it's a no, and I think it's something that we should keep in mind, though, because I think that the way that we communicate what we're doing, the way that we implement what we're doing is really important. And I think it's easy to have misunderstandings if we're not being really clear about what it is that we're trying to accomplish.
Yeah, and I really think that comes down to getting to know your clients and having open communication.
Yes.
And not taking on too many clients,
Yeah.
and really being able to understand each individual. Number 3, can true consent exist in ABA, especially for young or nonverbal clients?
Yes, I believe it can.
Yeah,
And
reaching, grabbing, I want to play, I want to engage,
yes,
this is fun, I want to touch the bubbles, this is assent.
no one is going to make it more clear than a 2-year-old if they consent or don't consent.
So
It's
true.
very, very clear.
Yeah, it is. It can be very clear. So much of our communication is nonverbal anyways. So
Yeah.
if you're really trained in nonverbal communication, which we are, you can really pick up on those clues very quickly. And you should not move forward if you don't have assent or informed consent. Informed consent is really that legal term. It lies with the guardian.
Yeah.
Right. But assent is in treatment if a child is showing distress or does not want to engage. We back off.
Yeah.
And you should.
You should.
Yeah.
You should, because really you're going to be most successful if you have buy-in from the child.
Yes.
They should want to be learning.
Yeah,
Yes.
you have to pair yourself with so much reinforcement that you are the reinforcer.
Yes.
That's what brilliant behavior analysts do. They're like, we're going to have so much fun. And I think, that is really, I don't want to get emotional here, but that's really one of the most phenomenal things we've done is like, at our Saturday social club, it's so fun for the children.
Yeah.
First, there's nothing they can't go on or climb, very little,
Mhm.
maybe something in the back room. But other than that, the whole space, they can go, they can run around, they can climb, they can ride the unicorn, they can body slam the inflatable dinosaur, like they can, and they're interacting with each other, and it allows for a lot of autonomy. And I think this is what the question is really asking. Can ABA provide autonomy to clients and patients?
Absolutely, it can and it should. And if it's not, then something's wrong.